Apollo Cancer Centers launches EndoCheck, an early screening and diagnosis program for endometrial and ovarian cancers *. EndoCheck will provide risk-based assessments, diagnostic testing, and symptom evaluation for women, particularly those in the postmenopausal age group. Bengaluru, 30th July, 2025, reinforcing its commitment to preventive oncology for women, Apollo Cancer Centers, ACCs, today launched EndoCheck, a comprehensive early detection program targeting women aged 45 and above. The initiative is designed to detect two of the most prevalent gynecologic cancers, endometrial and ovarian, at an early and more treatable stage. Ovarian cancer, often referred to as the silent killer affects women between 55 and 64 years of age, with the average diagnosis occurring at 63. When caught early, the 5-year survival rate exceeds 90%. In India, the total cancer cases are projected to grow to 1.57 million by 2025, with ovarian and uterine cancers continuing to report among the top 5 cancers affecting women.
They are, and yes, when we identify the high risk, we keep them under close observation, because it is not general. Once a year you do some blood tests and come back. Once a year you do your health check. No. High risk women, they need to be closely monitored, because they may need an ultrasound once in 6 months and not once in a year. And this will happen only if there is a proper consultation and proper history taking. So our message to women is that do not ignore even a minor symptoms. Do not brush it away saying this is just a minor, everybody has it, because we really do not know who has a...
There is staging of the diseases, so when it goes to stage 3 or 4, the treatment options are less. They become more aggressive with equal side effects and all. So it is important that the early diagnosis is made to contain the spread. And imaging plays a very crucial role in that aspect. So in radiology, in EndoCheck program, we use a high resolution endoluminal ultrasound, which is a transvaginal ultrasound. So it is a radiation-free, very easily available, non-invasive technique, and any women can undergo this without any hassle. So this gives good detail about the endometrial thickness. We actually measure the thickness. We have a criteria for premenopausal, postmenopausal. So there is a cutoff, size cutoff, above which we have to be suspicious. So this gives details about the endometrial thickness, how the endometrium interface with the adjacent organs, if there is any invasion or spread. Those subtle details can be understood. And as we know that cancer actually causes increased vascularity, blood supply. So all those blood supply, extra blood supply can be easily picked up using Doppler methods. And these suspicious patients are then subjected to biopsy. So it's referred to the gynae-onco. So they counsel the patients and probably do a hysteroscopy and biopsy. And if it is proven, again the role of radiology becomes very important. So in a proven case of endometrial CA or ovarian CA, we need to stage the disease. So we have very good diagnostic options like MR and PET-CT. So which gives both the local staging of the disease as well as spread to other organs. So we can holistically assess at what stage the disease is. So that is very important for the management option. So radiology has a very key role in the early diagnosis in stage.
So the Apollo team plans to partner statewide or nationwide to ensure that the person can get it done within the access point of their own living communities rather than traveling. Post that, if there's an intervention needed, as rightly said by Dr. Anik, people are coming to you late, people are coming to you because symptoms are not available, or somebody is getting a CA 125, which necessarily is not for gynec. It's for so many other cancers, and then thinking that you haven't done is actually post the intervention, diagnosis, get a biopsy done, figure out the staging, and then actually come to a gynaecologist. And that gynecologist today could actually partner, work with a gynecologist to create an access program beyond what exists today. And with the launch of this EndoCheck, we hope that people are able to access a test within their neighborhood, find an early diagnosis, get in touch with their own gynecologist, access the gynecologist, and access the gynecologist within the Apollo network, so that jointly they can actually ensure that they work together to win over the cancer. Today's ovarian cancer and endometrial cancer constitute close to about 78,000 new patients per year. And if you look at the change rapidly, endometrial cancer is the fourth common cancer among the cancers in women. And at the rate that you're seeing, the incidence might go to 3, and ovarian is number 2. And I think as members of the media and at people from the medical fraternity, it's a job to raise awareness at every touch point that somebody could understand this program and step forward and get an endo check. And I urge members of the media to create the desired visibility, readability, and also the decibel level of hearing it out. And I thank you for joining us today. Thank you.
Again, as I said, initial stages about endometrial cancer. Luckily, it has a precancerous condition where we call it as a hyperplasia. That means the cells are multiplying rapidly. If we do not treat that pre-cancer condition, it can turn into cancer. So most of the women, majority of them, we do pick up in a precancerous condition. If at all, we pick up in stage 1. Endometrial cancers, majority come to us in early stages because they have some abnormal bleeding, and a lady will understand, say, okay, this bleeding doesn't look like normal. So luckily, endometrial cancer has a precancerous condition, so majority do come to us in an early stage. These women will need surgery. Very rarely of early stages, whom we think before surgery was early, may Namaskara. My name is Dr. Rani Bhatt. I'm a gynaecologist and I work at Apollo Hospital. So today we are proud that we are introducing EndoCheck. Now, what is EndoCheck? In gynae cancer, after cervical cancer, uterine cancer and ovarian cancer is a common problem. Now, ovarian cancer, mostly we hear it's a silent killer. But silently, it is whispering in your ears what are the symptoms. If you have any abdominal distension or you're feeling bloating sensation, you're not able to eat properly, then that may be gastric issue. But if it doesn't subside with a simple treatment what you're taking, please visit a specialist. They will do a simple test and they will tell you whether it's just a gastric issue or there is something wrong with the ovaries. Again, if somebody has irregular bleeding, most of the women, they think periods are about to stop. No wonder I'm having this irregular period. Sometimes after period has stopped, after 1 year, suddenly they start bleeding. That may be something serious there. So when you have these abnormal symptoms and they're just not decreasing with the normal treatment what you're taking, I sincerely advise you to go meet a gynecologist. And again, before going, just make a list of all your complaints what you have and talk to them. Be frank with them and tell what are your symptoms. A simple test like a simple ultrasound will tell us that is there anything wrong with the uterus and the ovary. If it is so, then getting a correct proper treatment will prevent cancer. And even if we identify cancer in early stages, cancers can be cured when we detect early. So my sincere request to all the women out there is that do not neglect your body symptoms. They are silently telling, please visit your doctor today.